Hamlet has been having delusions, hallucinations, anhedonia, lack of motivation, and poor speech. He sees ghosts and all Denmark thinks he's crazy. But what is actually happening? You, being the smarty pants that you are, diagnose him with schizophrenia.
Most people believe that schizophrenia is caused by abnormal dopamine activity in the brain. Dopamine is a neurotransmitter that is expressed in the central nervous system and regulates things like motivation, cognition, emotions, and the reward system. Dopamine binds to dopamine receptors, which are G-protein coupled receptors that are located in the postsynaptic membrane. This changes the structure of the receptor, which can then activate a nearby G-protein by exchanging the bounded GDP molecule for a GTP molecule. Once activated, the G-protein splits, with its alpha subunit and the bound GTP moving to bind to adenyl cyclase. The adenyl cyclase is then activated, producing cyclic AMP and spreading the signal throughout the cell.
Schizophrenic patients have abnormal activity at dopamine receptors, specifically D2 receptors, with increased dopamine levels in the mesolimbic area of the brain and decreased levels in the prefrontal cortex. Increased levels cause positive symptoms like hallucinations and delusions, while decreased levels cause negative and cognitive symptoms like lack of motivation and decreased levels of emotional expression. Because of the true cause of schizophrenia is unclear, treatment aims to reduce symptoms instead. Antipsychotic drugs, specifically risperidone, binds to neurotransmitters like the D2 receptor and inhibits dopamine from binding, which alleviates positive, negative, and cognitive symptoms.
However, treatment doesn't always work. Some are unresponsive to medication, most drugs only reduce positive symptoms, not negative or cognitive ones, and antipsychotics have severe side effects. And in general, schizophrenia prevents people from leading normal lives. They can't form relationships or get an education or job and need constant support to manage symptoms. Therefore, social awareness is needed to help those with schizophrenia. Understanding schizophrenia can support patients, especially ones with suicidal or unhealthy lives, decrease rehospitalization and stigmatization, monitor treatments, and bring them closer to normal life. And there we go. How can you help Hamlet and others like him?